right here in Abuja. So, yes, of course, we'll be having this conversation with Dr. Olatunji, and it promises to be an amazing one. Should they look forward to it?
Yes, yes,
Of
yes.
course they should. All right, keep it locked in. Let's go back on a very short break, and when we get back, we'll keep the conversations going. Do not go anywhere. Right, welcome back again. 11 past 11. And of course, you know it's the nation's capital, Eagles 102.3 FM Abuja. It's your radio experience you can count on. And right, of course, I did tell us that we have Dr. Olatunji Abdul Hakim, who is the consultant and orthodontist, head of Department Dental and Maxillofacial Department, University of Abuja Teaching Hospital. And he is also the chairman NDA FCT. So today, together with Dr. Olatunji, we will be creating awareness for oral health in communication or in commemoration the World Oral Health Day, which takes place tomorrow. So welcome again.
Thank you for having me. Thank you.
Before we go into anything, see this orthodontist here is something I'd like to know about, because we know orthopedic, we know orthopedics, we know dentists, but orthodontist is something, that might be quite new to my ears, and I'm sure everyone here would be wanting to know exactly who an orthodontist is.
Thank you very much. All professionals that handle teeth are dentists.
Thank you.
But when you do postgraduate studies, you specialize in some aspect of dentistry.
Yeah.
Orthodontics is an aspect of dentistry.
Mm-hmm.
We have some other aspect like maxillofacial surgery, restorative dentist. It's good that you mentioned orthopedics. It will make it easy for me to explain what orthodontic is. Those words are Latin words orthodontist.
Okay.
Orthodontist. Ortho means straight and dentist means teeth.
Okay.
But
Straight?
orthopedics, straight limbs. You understand?
Okay.
So orthodontist is a professional that straightens crooked teeth by use of appliances, most time braces.
Braces. Okay. Braces. Thank you so much for clarifying that for us. Now, we're talking about oral health. When we talk about oral health, what exactly are we looking at?
Well, oral health is very important because if you look at the mouth, the entirety of the mouth is the oral environment.
Mm-hmm.
It has the teeth, the gums, the tongues, and other soft tissue in there. It's important to keep the health of these tissues because that is the entry to the body.
Okay.
And then it's also said that this is like a mirror of the entirety of the body, because if you have one or two things going up in the body and the entire systems, you're able to pick it from the mouth.
Mm-hmm.
So, very importantly, the route of entry to the body is very, very important. So if it's not fine, if it's dirty, you can be sure that the entire body will also be suffering the same.
Mm-hmm.
So oral health is very, very important. And what we found out is that most of the times in the cities, people pay attention to oral health, and then largely in rural environments, if you go there, you see that the oral health is in a mess.
Mm-hmm.
So that's why most times we actually concentrate a little bit out of those that could afford dental treatment or are close to get information about dentistry, so that we can create awareness and then help them in the little way we can.
Okay. All right. Now, when we speak about oral health, a lot of people just narrow it down to the offensive odor that comes from someone's mouth. That's the problem. That's the major problem a lot of people have. What is the cause of this kind of, is it poor oral health? Is it lack of proper management of the tooth or whatever? But what exactly is the reason for that?
You see, that's what we call halitosis.
Okay.
Bad breath is just one of the signs of a bad or a poor mouth, poorly maintained mouth.
Okay.
But beyond that, there are also some other diseases that affect the teeth, the tongue, the gums, and so. But we look at it in the matter of how common they occur. For example, amongst the elites, what we have most is dental caries, tooth decay.
Okay.
Tooth decay can give rise to mouth odor, because when you have holes in your teeth that food you have eaten weeks ago are packed in there, it's just like you're having those beans in the mouth, and then this is going to get out some odor. It can also emanate from when you have bad gums, the tissue holding onto the teeth, when they are diseased as well. Mouth odor can also arise from even outside the mouth, can come from the chest, from the airway, from the stomach, can come from around the ENT regions, the tonsils, so it's just a sign that something is actually going wrong, because if everywhere is fine, odor will definitely not come out. So that odor oftentimes is a sign of an ongoing disease.
Okay. So now, we're talking about bad breath generally. There are cases where people who haven't eaten all day. This is one common thing that a lot of people too are also confused about. I am confused about that as well. No matter how, should I say, orally sound or orally healthy you are, at a point where you don't eat for a long period of time in a day, then by the evening period, your mouth is all stuffy and all of that. What causes that?
Well, I think that may be responsible. There's some factors may be responsible, more than one factor actually.
Okay.
Sometimes diet, the last diet probably you took before you had that break, actually can be because some people, for example, ginger, I think is one of it or something.
Garlic.
Beyond that, when you don't eat and when your mouth is, for example, let's say you are fasting, then all through, you realize that your mouth is less active, there's less production of saliva.
Yeah.
And then there's no sterile mouth. So the organism in the mouth, you understand, because saliva has a protective function, they have more power over the other defense, the mechanism in the mouth, and then they can act on whatever debris is left there. And then, but that is not really halitosis, actually. It's not halitosis. Because that will be catered for as long as you open that mouth and brush and then understand. But halitosis is that persistent one. Even whether you eat or whether you do not eat, you feel this odor, and then people around you complain. Because even sometimes halitosis are not true. And they are not true, can be psychogenic. A patient comes complaining about halitosis and you try and check, you can't feel anything, but this individual is just having some other issues, and usually this one is not a true halitosis. So the one you just asked about is not real halitosis. It's just that the mouth has been stagnant. You have not really used it. Saliva flow is reduced and go. And then definitely you have some debris here and there. And then those are acted on by bacteria. And you have some little odor.
Okay. So now how can you treat halitosis?
Well, it is straightforward. You treat that identified cause. If halitosis is caused by having multiple dental caries, you get those teeth filled. If they are gone beyond filling, you get them extracted, or some other treatments that will make sure that tooth is healthy and the cavity is closed.
Okay.
If you have it emanating from the gums, you need a periodontologist. They clean the gums, they give medication and eliminate pockets where food items can pack in and all those ones. If it is for sometimes even when you don't brush your tongue well, because our tongue surface under a microscope is has a lot of crevices, things can hide. Also, toothbrushing, the poor hygiene can just be there. Whether you have this or not can be a cause of that. Those are mainly the ones that happen within the mouth. But if you look and you feel that it's somewhere around the neck, you can send the patient to an ENT surgeon, ear, nose and throat surgeon. And it's going from the chest, you also refer appropriately, or the stomach, to also GIT physicians to check and handle, because the halitosis you're feeling is just the air, the breath, and that breath does not really emanate from the mouth. It moves around the lumens in the body, so it depends on where it's emanating from, but it will come out of the mouth, and that we perceive there. So, but oftentimes it comes from within the mouth. Those other ones are not as common as within the mouth. So the treatment is directly treating what is responsible for this halitosis. Sometimes we also recommend use of mouthwashes, and some of them just serve as camouflage, because when you rinse with the mouthwash, it actually takes off this smell, but over time, so that's just a temporary measure. But the true cause of that bad breath actually must be taken care of before that bad breath can be totally eliminated.
Okay. Now, about cavities. Most times they'll tell you when you have these cavities, you go and fill up the cavities, right? You fill them up so that, you don't have deposits of food right there that might cause halitosis or smell or the bad breath that we talk about. But oftentimes when you fill it, you still have that again. Say maybe after a couple of years, you have filled your cavities. What happens that makes, it go back again. I don't know if it's reversible or something.
Sorry, I didn't get that. So, are you talking of
some people will say yes, recurrence of that. Yes, yes, you feel it before, yes, and it's coming up again.
Well, it is not. I can put that as two factors. It can be a patient factor. It can be a doctor factor. If you have patronized the quack, there are ideal yes, there are ideal doctor factor or operator factor. There are ideal materials, technique of doing this procedure. If it's not well done, some are moisture sensitive. If you don't isolate while you're doing it, I'm sure that this feeling will fail.
Okay.
You understand? So, but on the patient side, having a cavity that has been filled, and then if you go back to those factors that promotes having cavities, so you are likely to have cavity develop from any part of your teeth. It might be from around the filled parts. There's something we call secondary caries, secondary cavity. There's a primary one, there's a secondary one. So you can have it developing around the margins of those fillings. So this could also happen. But the truth is that when you have, it's always good to get your teeth filled on time so that it doesn't go beyond that level. Otherwise, you have what we call root canal therapy or extraction. How do you know? What are the early signs that this teeth is will need a filling? It is that you're going to feel what we call sensitivity. The outermost layer of a tooth, the enamel, does not have nerve supply. So if you take cold water, hot water, sweet things, you don't feel anything. But the underlying layer, dentine, has innervation. You can sense the environment. So when that part is exposed, whether you can see it physically, you cannot see it. When you take things like cold drinks, hot drinks, sweet, you feel this shocking sensation that will just be momentary. When you feel that, there's a leakage somewhere. So at that point, if you present to the dentist, he will localize that particular point and seal it off.
Okay.
So, and then, the issue of thinking that you feel our teeth and then we go again for 10, 15 years is not good. Ideally, we expect to see our dentist every 6 months. What we call scaling and polishing. It's just to get to the teeth, to get all the deposits hanging around there that toothbrushing cannot handle, to get them out. If you go for this regularly, the dentist would discover new or very fresh lesions that they can easily treat. But the habits around this part of the world is that as long as we don't have pains and food can go down the throat, we will not bother until we have swelling or we cannot sleep again. Those are the two main reasons why they come and say dentist. So you don't have to wait for that. When you see these early signs, it is easy to treat for the dentist. It is also cheaper to handle by the individual.
All right. Now let's talk about we've talked a lot about all of these questions, but we'll still be opening up the phone line, so anyone who has questions or any confusions about their oral health, you can help them out with it. But there's one thing as well we'll need to talk about, and it will be braces. Now, I personally have been thinking how exactly these braces work. Just stick out some metal on your tooth or your teeth, and then all of a sudden it arranges. And how does that work?
Well, it follows a principle, we call it tooth movement. The tooth, every tooth in our mouth has blood supply, has nerve.
Okay.
The bone around it is they also have these structures, nerves and blood supply.
Okay.
So there are cells around this tooth that when you apply pressure, they respond, and also when there is tension, they also respond.
Okay.
For example, on the side of pressure, because if you want to move a tooth, by the time you drag towards one side, the side you are dragging to has pressure, because you are actually tightening that tooth on the bony wall. So that side of pressure, the cells there would open up, would destroy bone, and then on the side of tension, the other side where you have tension, cells there will start laying down bone.
Okay.
But often in orthodontics, we use light forces. We use very light forces so that these teeth are moved without cutting off their blood and nerve supply. So it takes time. That's why wearing braces takes a period of time. You cannot move it within a day or two or 1 month. So you have to gradually apply this force. So the cells, the one on the side that actually clears the way. They are called the osteoclast.
Okay.
While on the other side, the ones that form new bone, closest where is open, is called the osteoblasts. Once these cells are active, the mediators are fine. When you put in this appliance and apply your force, the teeth would move.
So now the teeth has bones.
Well, the tooth is hard structure. In fact, it's the hardest structure in the body. So,
Yes,
but there's a bone surrounding the tooth.
Okay.
Holding that tooth in place.
Sure.
It's attached to that bone by some fiber that we call periodontal ligament. So you understand? So it is the bone that surrounds the tooth that is being modified.
Okay.
Because it has been modified. It's being destroyed on one side, it's being laid down on one side. So that as it moves, it doesn't leave any cavity, it doesn't leave any space.
Yeah.
So on the other side, it's clearing way, on the other side, is filling it up. So
Okay.
it moves right to wherever you're directing your force to. So that's the basic principle of braces.
So how long would it take, if you apply braces, how long will it take to adjust that, whatever defect it is you're trying to address with the braces?
The duration of braces depends on the problem you are treating.
Okay.
Appliances, we have in orthodontics, we have the removable appliance, we have fixed appliance, functional. It depends on the problem you are solving. It also depends on the age of the patient.
Okay.
For example, if you are handling a mild form of malocclusion, if mild form of malalignment, it definitely will not take as long as when you have an established malalignment
Okay.
all around in someone that is elderly. The ideal time actually, for it doesn't mean that that's the only time for you to get braces on, especially when you can key into growth of that patient, is usually between 10 to 14 years. And that's the period that the growth spot, the height of growth, the graph of growth jets up. So that time, but it doesn't mean that you cannot get braces. We do braces across, but we may actually employ some other means aside from growth modification.
Okay.
So we can also do camouflage in those old patients that have things that would have been corrected while they were actually within this age. So, but I would want to say averagely, we say like let's say like 12 to 18 months in a good patient that follows instruction and turn off appointments. So it's not a strict thing. It also depends on the physiology of the individual you are treating, because if I apply force in an individual, the response is different from another individual.
Yeah.
So what I get in 1 week movement from one other may not be gotten in 1 week from another patient. So but an average period of, let's say, 18 months, about for
18 months.
Full fixed appliance.
Okay, 18 months for braces. All right, guys, of course, I am still hanging out here with Dr. Olatunji Abdul Hakim, and he is a consultant orthodontist, head of Department Dental and Maxillofacial Department, University of Abuja Technical Teaching Hospital, and he's also the chairman NDA FCT. And of course, we're here together creating awareness for oral health in commemoration of the World Oral Health Day. I hope we're picking one thing or two about our oral health right here. But, of course, we'll be going on a very short break. When we get back, the phone lines will be open so that you can ask the doctor whatever question you have or you're willing to ask about your oral health. Remember, this is where you get free consultation. Don't say I didn't do anything for you guys. Thank you so much, Dr. Olatunji. And of course, thank you all for listening. We'll be right back. Keep it locked in.
The good tunes just don't stop.
Eagles 102.3 FM Abuja. Nigeria is a country blessed with fertile ground, with our fields spread across the horizon. Are you ready to sow the seeds of success in agriculture? Introducing Agropreneur, your partner in pioneering accurate information on agricultural practices in Nigeria and beyond. Leading the way, innovating agriculture every single day. From the fields of Nigeria to the world's grand stage, we are planting the future, turning a new page. Join us every Wednesday at 11 a.m. to learn more about agriculture and the fertility of the African soil. Agropreneur, growing a bright future for agriculture. Out with the tweets, in with the X's. This is X Trends, where we go with the trends on X and dive in. It is fun, intense, and very interactive. Join us on X Trends on Eagles 102.3 FM Abuja, your radio experience you can count on.
All right, welcome back and thanks for staying with us. This is Eagles 102.3 FM Abuja, and it is your radio experience you can count on. Remember, we are hanging out with Dr. Olatunji Abdul Hakim, who is the consultant orthodontist, head of department, dental and maxillofacial department, University of Abuja Teaching Hospital, and he is the chairman, NDA FCT. Thank you so much, Dr. Olatunji.
Thank you once again.
Now, this entire conversation is in to create awareness for the oral health in commemoration of the World Oral Health Day, which takes place tomorrow, the 20th of March 2024. Every 20th of March is the World Oral Health Day. Now, if you have questions you would like to ask Dr. Olatunji, I'll be opening up the phone lines right about now so that you can call in and ask your questions on 090-7353-0044 or 090-8766-8888. You can also leave us a message on WhatsApp letting us know what your thoughts are or what the questions you would like to ask the doctor on 090-9705-4450. I guess we have calls, so let's deal with that before we talk about the World Oral Health Day. Hello, good morning to you. Hello. Yes, good morning.
Good morning. How are you doing?
Very well, thank you. Please tell us your name and where you're calling from. Chidebere.
Yeah.
All right, it's good to have you, Chidebere. Talk to us.
Please, I want to ask the doctor. Is doctor hearing me?
Yes, he can hear
I
you.
can hear you, Chidebere.
Doctor, welcome to the studio.
Thank you.
I want to ask if it is okay for someone to brush his teeth every day.
If it's okay to brush your teeth every day,
Yeah.
okay.
Because one of my friends who had toothache, he went to the hospital and he said that the doctor said that it's not good for him to brush every day. So when I heard this program, I said maybe it's an opportunity for me to confirm.
All right. Chidebere, you know what? Just keep listening so that we can take more questions and then the doctor will answer all of your questions.
All right.
Thank you. Thank you so much for bringing that up. Wow. Let's keep it coming through on 09073530044 or 09087668888. Leave us a message as well asking your questions, and Dr. Olatunji will be here to help us answer all of those on 09097054450. Hello, good morning to you.
Good morning.
Yes, welcome and thanks for joining us.
Thank you. My name is Taufik Abdurrahman. Good morning, doctor.
Yeah, good morning, Taufik.
Thank you. My question is two. One, which one is better between braces and Invisalign?
Okay.
And the second question is there like a age cap where you can get braces or tooth alignment? You can someone who is 40 or still, do braces or just designed to fit and just accept the teeth as it is, or it can be done at an age. Thank you. All
right. Thank you so much, Taufik, for your question. We'll answer the question shortly. I'd advise that we send in the questions as many as possible so that he can address it all. 44 or 09087668888. Do leave us a message. In an instance where you cannot get to us via calls on 090-9705-4450. So, doctor, let's hear you.
Yeah, thank you. To say that I was shocked when you said you went to a clinic and they say it's not good to brush every day. That is totally wrong. Toothbrushing is the mainstay for keeping good oral hygiene. And it is said that you should brush minimum twice daily. Twice daily. You should brush in the morning and last thing before you go to bed. I guess probably your friend was brushing with a wrong technique. If you do that, you can also damage your teeth. And probably they should have corrected the technique and encourage brushing. But there is no sound clinic, a sound dentist that will tell you that you should not brush your teeth every day. You have to brush your teeth every day, and the best.
All right. Hello. Good morning to you.
Hello. Good morning, my beautiful sister, Matama. Good morning, Doc.
Yeah, morning. Good morning.
Yes, my name is Hundu, all the way from Nasarawa State.
All right, Hundu. Let's hear you.
Yes, Doc. Thank God today I have you in the studio. One of the things that has been disturbing me, one of my friends wants to be a boxer. And each time I see people like Anthony Joshua, they were fighting. The opponents try to target their mouth. Is it really going to be affecting their teeth? It's one thing I want to ask because from him. Because after making all money, you won't enjoy that money without your teeth. So, docs, thank God you are a dentist. Is it really going to affect their teeth? Since their opponents always targeted their mouth and their teeth. Thank you.
Thank you, Hundu, for that question. Let's go on. Hello, good morning to you.
Hello, good morning, Mata. Good morning to our guests.
Yeah, morning.
My name is Salasi.
All right, Salasi.
I want to contribute to what the doctor is saying, that it's good for us to brush our mouth regularly. And it depends on the type of the brush some people use. Maybe the person was in kind of complaining, maybe he's using hard brush that may even end up giving him some wound in his mouth. Maybe that's why he's like that. You don't have to. But there's another thing. I was having this tooth problem. So that was because I was in kind of going to see dentist. So I said, let me make sure that I brush my tooth very well. Getting to the place, they look at my tooth, and there was a broken tooth. There was a tooth that had hole. So they now say, okay, before they will do any other thing, I have to go they have to wash my mouth. In fact, in that place, that federal secretariat, they have new equipment. In fact, with the brush that I did, as if I didn't do anything, they wash my tooth. The kind of taste that come out, I was in kind of surprise. They now say it's advisable at least in every 3 months or 6 months, we need to go to the place to wash my tooth. In fact, it was so superb. In fact, I was kind of looking at my tooth on the mirror. I say, wow, so is that Salasi's tooth? So these are things, it's very good. Once in a while, we need to see the dentist. Honestly, going there, it will make our oral to be wow. Thank you.
Right. Thank you, Salasi. Thank you for reiterating that right there. I guess you'll be addressing it while we'll just be taking questions alongside that.
Yeah, thank you. To respond to Taufik's question about which one is better between the braces, whether metal, ceramic, Invisalign, they move teeth. But the reason behind Invisalign is to hide the appearance of braces.
Okay.
It makes it almost invisible. We call them clear aligners.
You see that line one?
Invisalign is a trade name. When you put it on, you don't see anything.
Nothing, yeah.
You understand? By the time saliva flows in around there, you won't see anything. But I'll tell you that Invisalign might not be able to handle complicated cases. And if you have to do that, you have to put attachments and put rubber, elastics. It will almost come to the other ones are very visible. You see metal, you see colors. You understand? They are both orthodontic appliances, but one is very obvious, the other one is...
That's a man of microphone. You see, so many brush where would they use the brush, not the brush. Some not the brush teeth. Me I buy wait for your teeth.
Hey, doctor will tell you that one, bless you know. Wait first.
No, I'll be doctor, I can doctor you now. I'm not only doctor.
All right.
Not for my family, for my village, they get doctor.
All right.
But they will tell you what you can use or charcoal. Or, go see one near your teeth. But now the kind of cream what they do for Nigeria for us to use is killing our teeth. You cannot chop. Can you chop bone? You cannot chop bone after meat. Now fresh, you want to chop. But for my business, that bone they go give you, go manual, you go cutter, leg of fowl, you go use your teeth to break her. But the current bone give people that to choose, they cannot because their teeth don't weak because of machine where they are using. Why make one? They enter people's teeth, they remove teeth anyhow.
All right.
Not for my business, you cannot see anybody remove teeth. Maybe they use salt.
Latunji, you have a lot to answer here.
I'm here for that.
All right.
Okay, second question for Taufik talked about age cap for braces. There is no age cap for braces. As long as you are alive, you are eligible to wear braces. But the only thing is that you might have a longer duration in those that are older, you understand, then a shorter duration. And also, you can even put on braces or appliances as early as 3 years of age, when you know that this thing can be corrected and
Early
then
enough.
you can guide the growth of the skeleton. So there's no about injuries, even though they make a lot of money. If you look at it, maybe if you look closely while they're boxing, there's something they wear on their teeth to actually dampen the force around the teeth. So that, but even notwithstanding, injuries can happen. But these injuries are very manageable.
Mild.
I'm sure that the kind of money Anthony Joshua collects, just a little bit of it, money, whatever happens to the teeth. So if you look at the risk and benefits, the benefits are
It's much more than the risk. That's it.
So that is that. Yeah, to Mr. Salasi, I want to appreciate you for shedding more light, and then also coming from you to other listeners. It is good. I said it earlier that you go regularly for checkup when we do skin and polishing. Yes, if you use hard toothbrush, you are going to damage your teeth. You're going to cause cervical abrasion. So that's why I talked about the right technique. Studies that were published by dentists that actually recommend some specific type of chewing stick. It's not that just cut any. They have checked chemically into the agents in this stick. Some of them has antibacterial chemicals in them. Aside from that, the basic principle behind toothbrushing is for you to have bristles that can reach corners and clean the teeth. So if you're using a chewing stick, you have to chew that stick so that the stick will have bristles. A lot of people will just put that stick at the corner of the mouth and drive around, and they will just, they will not make any movement. So if within just 5 minutes you get that well chewed stick and then use it to clean areas, it will work as well as toothbrush. But looking at toothpaste, you talked about abrasive, you talk about charcoal, all those things, ashes. Is it that will strengthen the teeth? The toothpaste is a formulated chemical that they put all ingredients to clean and also strengthen the teeth. So nobody has ruled out chewing stick, but if you want to use it effectively. If you don't make movement around with it, you are not going to have a clean mouth.
But you can't use your chewing stick to clean your gum.
When
sorry, your tongue.
No, you can't use your chewing stick to brush your gum. So that might be one of the side limitations of your chewing stick. But you can use your toothbrush to actually brush your tongue. So that's another limitation that a chewing stick will have when compared to toothbrush.
Now she also the charcoal now is completely ruled out. You cannot use charcoal.
The charcoal
ashes.
is not ruled out. The charcoal is, I just mentioned scoring powder.
Yeah.
Charcoal, when you grind all those things, you have small particles that when you apply friction on that object, it cleans it without leaving line on it. If those particles are big, you're going to clean and score and have lines. It will become rough. But because they are fine, they will smoothly scratch out that surface and clean it. So charcoal also belongs to. In fact, some people will grind glass.
Yeah. They
grind glass. It's the same principle. But all those ones have been incorporated in a good toothpaste. And beyond that, some other chemicals that the tooth needs to get straightened.
All right. I guess you answered this question. Sanusi was also asking about chewing sticks. And then he says, yes, this one says, "Good morning, beautiful and doctor. My name is David. I have a question. He's a doctor, so I believe he will know this. Notice 1, 2. What could be the cause when someone did not use to last? Sorry.
Urologist.
Yes, you go to a urologist. So Hakim has been spearheading the conversation right here. Thank you so much. Sanusi happens to be an admirer. He says, Ramadan Karim to my eloquent brother, doctor in the house. He's very versatile, and we have really drunk from his well of knowledge and wisdom. He always gets my admiration anytime he speaks. This is from Sanusi right there. All right. Let's just quickly talk about the World Oral Health Day before we head out, because we have very few minutes.
Like you said earlier, World Oral Day is a day that has been set aside for dentists all over the world to celebrate oral health.
Mm-hmm.
And the essence is to it has been on for years and then been having different kind of, for example, last year was Be Proud of Your Mouth. So this team was actually arrived at the conference of World Dental Federation in Sydney, September last year. So, and the theme for this is a happy mouth, a happy body. So the essence of this is for us to create awareness, to enlighten, and also assist people, especially those that are low financial income. And that is why from tomorrow we'll be having some programs within FCT that will have in fact some form of treatment. We distribute dentifrices, toothbrush, we distribute toothpaste, and then we give oral health talk. We demonstrate how a good toothbrushing is done, amongst others. So we're starting that from tomorrow. We'll have it in different locations up till Friday. So I think that is the end of World Oral Day. We have a Nigeria Dental Association, actually, which is an affiliate of World Dental Federation. It's celebrated worldwide. So we are going to, at the end of the day, we are going to have a meeting all over the world and interact and see how we actually participated all over the world. So this is the Abuja part of Nigeria celebration. We have it in all going to happen in all the states of the federation tomorrow, and all over the world as well tomorrow.
Okay. All right. Consultant orthodontist, head of Department Dental and Maxillofacial, University of Abuja Teaching Hospital. He's also the chairman, NDA FCT, and we have had the privilege of having these conversations with him and clarifying on some issues that we did raise here on radio. Thank you so much, Doctor. We look forward to having you again in the studio. All right. To everyone who has been out there listening as well, thank you so much. We really appreciate your time right here in the studio. Now, one last thing you'd like to say to our listeners, for everyone listening, about their oral health, and maybe you touch a bit on the toothbrush.
Actual name, because I'm not selling any products. Yes, if you want to get a good toothbrush, the head of that brush must not be more than 1 to 1.5 inch. The bigger the head of the brush, the less effective the brush, because if the head is big, it will not get to the last tooth at the back. So it should have a minimum of 3 rows of bristles. And if we have the time to even count those tufts, you have those bristles arranged isolatedly, you should not be less than like 10 to 12 fibers in a tuft.
Wow.
You understand? So, and then it's also good if those bristles are facing different directions. It's also good. So if you want to get a brush, when you hold the brush, just look out for what I've just mentioned. You say that this is a good brush. But you say a brush that the head is big, that it will not clean effectively as it should be. And it's also good for you if you use it when you are brushing with, when you have a toothbrush and then the bristle starts to scatter, then you have to discard that toothbrush. So that is the main thing. But if you have, for example, I bring in a toothbrush from United States, very good quality, and then even over 3 months the bristle is still standing the way they were manufactured, then that toothbrush is still fine.
How often should they change toothbrushes?
Well, people will say 3 months, but I've just said that if the bristles are still standing, the head
scatter everywhere.
So just throw that away, and then just look at that toothbrush is not a good brush. Averagely, let's say that 3 months you change your toothbrush.
All right. Anything you have to say to them out there?
Well, as part of the World Oral Day celebration, I just want to let people know that oral health is very, very important. And like I said, you have a lot of infections, a lot of things that are socially stigmatizing, that if you don't take, aside from the fact that your body is not healthy, understand? If you speak in public and people have to cover their nose or move back for you,
that's a problem.
These are social embarrassment. So if you can actually avoid this, you're talking, go your regular to dentist periodically and let them do these little things, and then you have a sound mouth. They believe that old people would not have teeth, all their teeth will fall off when it is wrong. It is because they have abandoned their teeth for a long time. So by that time they get to that, then those teeth will start getting mobile and start falling off. You can have your teeth 90.
Guys, this is your cue to take proper care of your oral health. Thank you so much again, Doctor. I'll see you in the next hour, and there you already know what it is like. Today in 60 comes right up.
102.3 FM, Abuja, here to stay.